just like it was last year when we had to deal with many difficult challenges. Of course, they will come together in the same spirit, and that's why I'm very confident that the issues and problems we're currently beset with will be resolved. There are two issues. Initially, the problem was with the supply of overseas vaccines. That's what slowed down those first few weeks until the AstraZeneca vaccine, which was being produced in Melbourne, was able to come off the factory line, to go through the fill and finish process, go through the batch testing and become available. Now, that AstraZeneca vaccine had ramped up to around 800,000 a week. The challenge now is the medical advice that has been received that deals with the rather rare instance where you can have the clotting occur for those who are under 50. I note that in the United States, the Johnson & Johnson vaccine is now facing some similar issues. This is why our selection of vaccines was so important. I mean, in recent days, the government has been criticised for not getting the Johnson & Johnson vaccine. Well, that would have been another adenovirus vaccine. We already had one of those, which was AstraZeneca, so we decided to go with the Novavax vaccine and to go with the Pfizer vaccine, an mRNA vaccine. So we ensured that we had coverage over the different types of vaccines, foreseeing that it is possible, although there was nothing in the early testing to suggest this, that any one of those vaccines could potentially have faced one of those challenges. Right now, our focus is principally on vaccinating people for whom the AstraZeneca vaccine does not present a challenge. Of course, there are those under 50 who are working as frontline health workers and aged care workers and others, but a vast number of those are also aged over 50, and the AstraZeneca vaccine is very appropriate for them, and those supplies of AstraZeneca are continuing to roll out. So I haven't finished yet. We don't have an issue with the supply of AstraZeneca vaccines. They are rolling out of our domestic manufacturing. The issue is in relation to the Pfizer vaccines. The Pfizer vaccine timetable that we have from Pfizer is ramping up over the next few weeks and months and into the third quarter of this year. We have secured an additional 20 million Pfizer vaccines that will become available in the fourth quarter of this year, and that will happen at the same time as we expect to receive the Novavax vaccines. So we will have if those supply lines hold up, and that is something outside the government's control, then we will have a substantial number of vaccines in the fourth quarter of this year. That is why we'll have to change our delivery method, because we would like to see this done before the end of the year, but that will only be possible if we can ensure that we have the max vaccination program in place that can do that in that space of that final quarter. Now, prior to that, we will have AstraZeneca vaccines that we believe we might be able to ramp up the pace of vaccination for those aged between 50 and 70. Now, that's millions of Australians, and we have a very strong GP network now of over 4,000 that we can work those vaccines through. But equally, there's the option to work, and I've discussed this with at least one Premier, about how max vaccination could be an option earlier, say in June or July, for those over 50 groups that are in the balance of the population, and it's a very large number. And there will be vaccines, we believe, to support that type of activity. Now, that just can't happen overnight, and that's why calling together the states and territories and the premiers for us to deal directly with this as leaders, to ensure we can get those systems in place, to understand what the risks are associated with that, what resourcing is required, and to be able to direct those programs as a national cabinet. That's what the meetings are for. Over the course of this week, the health ministers are meeting. They'll be doing that Thursday evening. The medical advisors are meeting this week as well. They'll put a first-pass set of issues before us next Monday. We'll start working through those issues. By the end of the week, we'll meet again, and we will work this problem and we'll solve it.